My name is Dr. Melinda Lacerna, and I'm a board-certified plastic surgeon from Bradenton, Florida. This afternoon, I will be speaking about my experience with plasma resurfacing combined with facelifts. This will take your facial rejuvenation results to the next level. As a disclosure, I am a key opinion leader and a consultant for Apex Medical, the maker of Renuvion. So during facelifts, pulling the skin tight is not the answer, as this only produces unnatural results and causes undue tension on the scars, causing unfavorable scarring. In addition, overfilling is also not the answer. I argue that it's all about beautiful skin, as shown here by my beautiful patient who's undergone plasma skin resurfacing. So plasma versus other deep resurfacing techniques. Currently, CO2 laser skin resurfacing is still the gold standard. However, these machines are expensive because they are a one-trick pony. In addition, they can result in patterning, and they are just not as effective in very deep rhytids and deep acne scarring, despite multiple passes. I know this because I had one for about 5 years before I started doing plasma resurfacing. Now my CO2 laser sits in my OR collecting dust, unfortunately. What about croton oil and phenol peels? Well, these can cause cardiac arrhythmias and cannot be combined with facelifts due to skin necrosis or slough. So what is plasma? Plasma is produced by combining radio frequency energy and helium gas. Achieving the ideal skin quality is one of the most important aspects of facial rejuvenation. And I argue that even the best tailor cannot make bad fabric look good. So as surgeons, even the best facelift surgeons really cannot have ideal results without having good skin. This novel technique combines deep plasma skin resurfacing with face and neck lifts, regenerative medicine with using PRP-infused fat grafting. This results in natural appearing rejuvenation of the face. So plasma resurfacing can be safe enough to perform the same time as facelifts, yes, even over the elevated skin flaps. There is no patterning and is extremely effective in obliterating deep rhytids, dyschromia, deep acne scars, and facial scars. And best of all, there is no cardiac arrhythmias. The RF plasma platform is also multifunctional, such that the subdermal used for skin tightening, facial resurfacing, and a bovie is all in one machine with interchangeable tips. The only cons is that the resurfacing procedure can only be done on patients with Fitzpatrick 1 to 3 skin types. There is a longer 2-week downtime and currently can only be used on the face and not the neck. This is what I call my facial rejuvenation trifecta. In my practice, I like to combine the latest and best techniques in face lifting and neck lifting with the latest technology such as plasma resurfacing and the best of regenerative medicine by using fat grafting and PRP. In the last 5 years since 2017, I have performed plasma resurfacing on 39 patients. 27 of these patients have undergone a combination facelift with full face resurfacing for 18 patients, and 9 patients had regional treatments, including 7 in the periorbital area and 2 in the perioral areas. 38 were females with 1 male, all Fitzpatrick levels 1 to 3, in age range from 35 to 84. I have used all types of anesthesia from local and tumescent combined with IM sedation, IV, or general anesthesia. The patients were followed up at post-op day 1. Then, since it's a deep resurfacing technique, there's a lot of hand-holding initially, and I see them 3 times a week for the first couple of weeks, then monthly and yearly. My longest follow-up has been 4 years post-op. So this is the technique. After tumescent solution is infiltrated subcutaneously, about 200 to 300 cc volume, the plasma resurfacing is done after the facelift procedure is performed. As seen on this video, this involves nice, even painting-like techniques, and I extend the treatment all the way to the area of the facelift incision in the preauricular area. The PRP-enhanced fat grafting is then performed last. This video shows another patient being treated also for her full face. This shows the treatment of her inferior perioral area. This technique is extremely effective for treating those very deep lines in the chin, marionette line, and perioral areas. This video shows the treatment of the superior perioral area. This is one of the most gratifying resurfacing techniques you can do as a surgeon because you literally see the rhytids disappear before your eyes. This video shows treatment of the periorbital area. It works great for those deep crow's feet and in treating that crepey eyelid skin. When treating the periorbital area, I go all the way from the eyebrow hairline down to the lash line. And surprisingly, this is very safe for the hair follicles and doesn't affect them at all. Post-operative course, as you can imagine, they look horrible on post-op day 1. They have a lot of edema all over their face, especially in the periorbital area. At about day 4, a lot of the periorbital edema starts subsiding and they start sloughing off their superficial epidermal layer. At 3 weeks post-op, they usually have completed their reepithelialization process, which occurs at about day 7 to day 10 post-op. At 5 weeks post-op, they start looking pretty good, and at 3 months, their skin has pretty much stabilized. These photos show long-term results of the same patient at 9 months post-op and at 3 years post-op. And this is her lateral view. And we can see that she looks a lot better at age 70 currently than she did 3 years ago at age 67. Some other case examples. This is my 73-year-old patient that I have performed perioral deep resurfacing with the plasma along with her facelift and neck lift and fat grafting procedure. She is 4 months post-op. Another patient who is 72-year-old at 6 months post-op, status post her facelift and full face resurfacing. Another patient at 74 years old, and she is 2 months post-op, status post her plasma full face resurfacing and her facelift and fat grafting procedure. This patient is 67 years old. She is 4 months post-op, facelift, neck lift, fat grafting, and full face resurfacing. You can really see the good improvement around her perioral area. Another patient who is 60 years old, and she is 5 months post-op. This patient is 73 years old, and she is 9 months post-op, her full face resurfacing, facelift, neck lift, upper bluff, and fat grafting. This patient is 4 years post-op from her full face resurfacing and short scar facelift with fat grafting. This procedure can also be done as a standalone procedure for resurfacing the face, also either regionally or the full face. I really like its application on the lower eyelids. In fact, in my practice, I really do not perform skin excision, lower lid blepharoplasties anymore because I hate dealing with ectropion. So in my practice, what I like to do is to treat the peri-orbital area with the plasma resurfacing, and then I perform fat grafting in the tear trough and then the lid cheek junction. And this patient is 3 months post-operative with no skin excision. This patient also had no skin excision. She is 73 years old, and she is 1 month post-op, full face resurfacing, and fat grafting. And unfortunately, she moved to California, and I didn't have any further post-op photos from her. This was the previous patient that I showed earlier in the talk, my 35-year-old French patient. She had undergone full face plasma resurfacing with PRP injections, no fat grafting, no skin excision, and she is 1 month post-op. Unfortunately, she went back to France and I was not able to get further post-op photos, but this is the patient's own photos that she sent to me. So results, there are no burns, no flap, skin necrosis, or skin slough. In the resurfacing only group, I had one patient who had transient PIH or post-inflammatory hyperpigmentation, and luckily this resolved with topical creams with hydroquinone, kojic acid, and tretinoin treatments. Two also developed hypertrophic scarring on the chin 8 weeks post-op. I attribute this from the use of face masks from the contact with the face mask because they healed really well immediately after the procedure. This luckily resolved with topical steroid treatments, non-ablative erbium laser treatments, and some Kenalog injections. In the facelift plus resurfacing group, I had one patient develop a Pseudomonas infection on her forehead 8 weeks post-op after she wore a headband on her forehead while she was working out. Luckily, this resolved with only 2 weeks of oral antibiotics. I also had one patient with the hypertrophic scarring on the chin that developed at 8 weeks post-op that also resolved with the previously mentioned treatment modalities. Again, there is a prolonged recovery with this procedure of up to 2 weeks, prolonged erythema of up to 6 months. However, both my patients and their surgeon were overall very satisfied with their results. So in conclusion, plasma resurfacing is safe and effective for treatment of deep-righted dyschromia, deep acne scarrings, and facial scars. Can be performed in conjunction with facelifts or as a standalone procedure in the right patient population with Fitzpatrick type 1 to 3. Currently, it is still off-label use, although the RF plasma device is FDA approved for subdermal skin tightening. The resurfacing technique is pending approval with the FDA and is hopefully getting this September of this year. For future directions, I am hoping to use this more on the neck and in the body, and this can be achieved by using more pulsed settings, therefore making the energy more fractionated. Thank you so much for this opportunity. It truly is a pleasure. Please do contact me by cell or email if you have any questions. And please come visit us in Bradenton, Florida. We always welcome if you want to do any case observations, either in person or via Zoom. Thank you again.